My name is Gillian Guy. I'm a patient at the Victoria Medical Centre, and I also use the South Westminster Centre a lot because there's so many facilities there, and it's terribly useful. It means I don't have to go to Chelsea Westminster Hospital so often.
South Westminster Centre here is a great facility, and it's ideally placed, and once it's completed and we've got more and more services in, it's going to prove to be a fantastic resource for the local population, and it's supported by a great team attitude, and the admin reception team and everybody within work really well together, so it is going to be a fantastic resource for the population.
We've designed these services because we think they're in the areas where there is most need, either in terms of longest waiting lists or most difficulty in getting the patient seen.
Our blood is taken at the South Westminster Centre. Our X-rays are taken there.
We've put in a new musculoskeletal service. We've put in a new dermatology service. There is a new cardiac health service gone in there, and we're looking about putting in a cardiac lab there, so people are going to have cardiac investigations locally instead of having to go across the water to St Thomas's.
So we've doubled the podiatry that we've got, and we've also been able to build a specific minor surgery room for podiatry so that people can have foot minor surgery done while they're here. We've also opened a diabetes service, so rather than patients having to go to the north of Westminster to receive diabetes care from the specialist nurse or the consultant, they can come here and see the entire team.
I think it's really important that some of the services here are aimed particularly at young people.
The challenge with the current financial crisis is to produce good services that are good value for money, that are near to patients, that have smaller waiting lists outside of hospital.
It's a much more cost-effective way and a more friendly way of providing a service for people near to where they live.
As soon as we've got the referral, which is pretty much instantaneous, the patient can then phone us up, and as soon as they've called us, during that phone call they will be given their first appointment.
Obviously, one of the key things that we've done is to involve patients in every step of the way. So they were integral in terms of being consulted around what services did they want to see coming into the centre, what services were most important for them, and actually where did they want a centre like this to be developed.
It's just over almost, as a crow flies, 5 or 6 minutes away. It takes about a 10-minute walk. And even people get buses to it if they're on the Churchill estate or live on the west side of the borough.
What we're really looking for, the big improvement, is going to be in IT. Now, that's going to be a matter really for the clinicians, but the benefit for the patients is that there should be one clinical record. So all the time you've gone to your doctor and said, I had an X-ray, where is it? And the doctor's had to go and look it up. That's not going to happen because it'll all be on one computer. The cluster have really very much driven the whole development of the South Westminster Centre. It's been clinically led, as well as obviously patient-led, and we've worked really well together, and the GPs have been fully involved during the whole process, as the patients were, in the design and delivery of what we've done here.
Great relief, great relief. Brilliant service.
Excellent.
Thank you, my dear, very much indeed. See you again sometime.